Endometriosis is a relatively common, potentially debilitating condition affecting 1 in 10 women of reproductive age group or those born female at birth. So endometriosis is a condition defined by the presence of endometrial cells outside the womb, and it causes chronic inflammatory reaction, scar tissue, and adhesions. So several types have been described. Superficial endometriosis is when it goes in the pelvic peritoneum. Then we've got deep endometriosis, which goes in the bladder, bowel, ureter, sigmoid colon. We've got ovarian endometriosis, when the endometriotic deposits go in the ovaries, and rare cases are outside the pelvis, like it can go to liver, spleen, kidneys, pancreas, and even to the brain. So if I give you some facts about endometriosis, 1 in 10 women suffer from it. At the moment, 1.5 million women in UK are suffering from this condition. Do we know any other condition where 1.5 million people are suffering? No. Yes, there are 1.5 million people who are suffering with learning disability, dementia, or Alzheimer's. But there, the 1.5 million are both men and women. Here, it's only women. 27 is the average age when a diagnosis is made. 60% are misdiagnosed. 68% see 3 or 4 different clinicians before a diagnosis is made. 80% are not able to do the household work. And it's causing the UK economy 12.5 billion per year. So now you've got an understanding of endometriosis, a debilitating condition, and something has to be done. It's not recognized as a priority. So we have to make an effort that women's voices must be heard. So impact is physical, mental, emotional, psychological, sexual, and psychosexual. And yes, it impacts on other issues as well, because it can cause problem to the bladder, to the bowel as well. And if it's spread to the lungs, then she can be coughing blood. So impact is physical, like I said, mental and emotional, because so many times she's seeing the GP, like I said before, 60% see their primary care physician 3 or 4 times. So many times they end up going to A&E. And again, no diagnosis is made. Symptoms dismissed, ignored, belittled, and sometimes they are told it's all up in the mental health. So it is affecting your mental health as well. Have we got any psychological services for these women? No. There is always delay in diagnosis. Why there is delay in diagnosis? Because the symptoms are not being taken seriously. If the symptoms are not being taken seriously, the investigations are not done in a timely manner. If the investigations are not done in a timely manner, diagnosis is not made and she can't be put on the treatment. So like I said before, 27 is the average age when a diagnosis is made. And she started her symptoms when she started puberty, when she started her period. Imagine a young girl not able to go to school, not able to do the homework, failing on her exam. A woman who has got a job, not able to continue with her role and being dismissed because her symptoms were not taken seriously. So it affects their mental health as well. Now, these women also suffer with infertility, repeated miscarriages. So again, if they are not able to produce the children, then sometimes their household are not happy with them. So it's not women's fault. Women's health has always been ignored in our country. Why is that? It's all because the healthcare system has been designed by men for men. All the research, the trials, the education focus towards men's health. When it comes to women's health, there's no funding. Why there is no funding? Because it's women's health. And these are the things I think we have to make a shout or a noise or raise our voices that something has to be done for women's health. And we all know if a woman is not well, the whole household suffers, the workplace suffers, our community is suffering, and our nation is suffering as well. As a GP with special interest in gynae, I'm always focused on women's health. When I was working in Oldham, I developed a community gynae clinic, and the aim was to relieve some pressure on the secondary care so that they could concentrate on complex gynecological problems. But seeing my patients suffering with endometriosis, waiting and waiting to see the specialist, I just could not understand why that was the reason. So I did a survey in my area with the help of Peter Gibson. So survey, we found out that 66% of men have never heard about endometriosis, but men were not alone. Even women did not know what endometriosis is. So I set up Endometriosis Awareness North in my area. And the aim was to raise awareness of endometriosis, promote education, raise funds for research, and who are suffering, asking them to come together, share their stories so that we can spread the message. So after that, for 4 years, I've worked nonstop. I've written a book on endometriosis in primary care. So where is the problem? The problem number one is practitioners' lack of knowledge about endometriosis. In a GP surgery, GP myself, in a GP surgery, we have got practice nurses, advanced nurse practitioner, physician associate, pharmacist, medical students, and a trainee medical doctors. So we have got allied healthcare professionals. They all should be updated. They all should be trained about endometriosis and other women's health conditions. And I always say every GP practice should have an in-house educational session, which forms part of quality improvement, which goes well towards your appraisal, because I'm a GP appraiser as well. So education among practitioners is at the top. Then the public awareness and education is equally important. What I have seen is that the women are suffering in silence. There is a stigma associated with talking about painful sexual intercourse, not able to produce children, having repeated miscarriages, especially Black and minority ethnic women. So they are suffering in silence. In my area of North, it is taking 11 years to get a diagnosis because these women are not seeing their GPs. They are worried. And like I said, there's a stigma attached talking about painful period and painful sexual intercourse. So I go to various community centers and empowering them with knowledge. The other thing which I'm talking about is education, education, and education. Not only the professionals, but the public as well. So the community centers, school education is another important thing. I've started going to various schools. Even the teachers are clueless about what a normal period is and what a heavy period is. So I go to the schools, raise the teachers, tell them about what a painful period is, what support they should be providing. Also, providing support at workplace. So if we've got a patient, a woman who is suffering with endometriosis, not able to deliver what is expected of her because she's in a debilitating pain. So rather than saying, thank you very much, we don't need your services, she should be provided the support. She can work from home or she can work less hours. And when she's in a fit condition, she will come and deliver. 3/4 of women are saying that their symptoms are dismissed and ignored, not only by the practitioners, but by the government as well. So we live in a country where your class, your gender, your postcode, decides the quality of life. Not acceptable anymore. Not acceptable.